All right, guys, today we're going to talk about autonomy, and then we're going to go to talk about truth-telling. All right, so autonomy. This is a person's rational capacity for self-governance and self-determination. Ultimately, it's the ability to make choices. So autonomy is your ability to make your own choices for your own life. Very simple. Paternalism. Now, when we talk about paternalism, we're talking about a concept that's related to someone else making decisions for you. So if you are incapable of making decisions for yourself, oftentimes you will appoint, prior to you losing your capacity, or the court or whatever, will determine someone to make decisions for you. This is called paternalism. So paternalism is the overriding of a person's actions or decision making based off of what's his or her own good. So what is best for the person, they are going to make the decision for them. So you have different types of paternalism. First type is weak paternalism. Now, weak paternalism is the idea that an individual is simply incapable of making a decision for themselves. They don't lack the cognitive ability to make a decision for themselves. So that would be directed to persons who cannot act autonomously or whose autonomy is greatly diminished, right? So that would be weak. Now the strong would be the overriding of a person's actions or choices, even though he or she is substantially autonomous. So if an individual is incapable of making a choice for themselves, it's weak. Strong is the person just lacks the ability. So we'll switch that. Strong paternalism is where they lack the ability. In situation. Refusing treatment. Is it ever wrong to refuse treatment? Or is it ever the right thing to force a treatment on another person? Now this is a good question, and I would recommend that you ask yourself this. Is it ever the right thing to do to force treatment on someone who is making the choice for themselves? They're capable rationally, they have their cognitive faculties. Is it ever wrong to force treatment on someone else, refusing treatment? Well, obviously that goes with what you feel your obligations as a medical practitioner are and the legal obligations that you have as a medical practitioner. Now let's move to the Hippocratic Oath. I'm sure everyone's heard of the Hippocratic Oath. This goes back to ancient Greece. Hippocrates, he developed this, and it goes back to 460 BC. And he said, "I swear by Apollo." Apollo was an ancient Greek god. And Eleusis and Hygeia and Panacea and all the gods and goddesses, making them my witness that I will fulfill according to my ability and judgment this oath and this covenant. So this reflects a religious perspective of taking oaths to humans and gods. So the Hippocratic Oath is in reference to a duty that one takes upon themselves if they are a doctor or a medical practitioner. And obviously this refers to two basic or fundamental principles, which is malfeasance. You never do harm to someone, right? Malfeasance. And the other one is beneficence. You're always looking out for the good of that individual. So malfeasance is you never do harm. Beneficence is you're always looking out for the good for that person. Okay. Physician autonomy. The freedom of doctors to determine the conditions they work in and the care they give to patients. So there is a little freedom that doctors and medical practitioners have in determining the conditions that they work in and the care that they're willing to give to patients. So it's not a situation where you always have to follow a specific set of rules, although there are guidelines. Physicians and patients are inundated with arbitrary treatment regulations and financial punishments for out-of-system treatments. As a result of these complex and somewhat contradictory, often covert and self-interested inducements from third parties, physicians often are confronted with resistance when they explain their treatment decisions to patients. Now, this is merely in reference to the problems associated with law and some of the legal obligations one may have when they're treating a patient. So oftentimes you'll find that your hands may be tied with respects to certain not only policies of the hospital facility you work for, but also some of the legal obligations that you'll find yourself in. An example of this are seen in the cases of antibiotic treatment. Antibiotics have not been shown to improve medical outcomes for otherwise healthy patients with early symptoms of decisions to patients. Patients believe otherwise, and therefore the situation puts physicians' obligations with patient wants. So oftentimes patients will constantly ask for antibiotics. The doctor or medical practitioner will see that this antibiotic is not going to help in their specific case, but the patient want is at odds with, in tension with, what the physician or the medical practitioner feels that they are obligated to in order to treat the patient. The beneficence that they're exhibiting toward the patient. And we'll just go on. We got a couple case studies, but we're not going to talk about the case studies today. Let's go to truth telling. So we'll talk a little bit about truth telling and confidentiality. Whether doctors and nurses should always tell the truth to patients, and whether doctors and nurses should ever reveal the truth about their patients to others. This is a really tricky and difficult discussion to be had, whether doctors and nurses should always tell the truth to patients. For example, a patient has a particular, some sort of particular ailment or disease or whatever. What is the obligation of the doctor to be honest with the patient? And whether the doctor and nurses should ever reveal the truth about their patients to others. And that's if an individual has a pre-existing condition, what is the obligation of the medical practitioner and the doctor in withholding that information? Because obviously, if that information gets out to insurance companies, that could really hurt them. And that's where we get into things such as HIPAA, which I'm sure you're familiar with. So the Hippocratic Oath does not mention an obligation of truth-telling or disclosure. So the Hippocratic Oath, although it does outline a strong case for beneficence and malfeasance, it really doesn't talk much about truth-telling or disclosure policies. And obviously this comes with the bureaucracy of a lot of hospitals and things like that. Okay. So a 1961 survey of physicians found that 90% of them would avoid telling patients of a diagnosis of cancer, while a similar survey in 1979 said 97% would disclose. So we've seen a shift in the past 50, 60 years or better of how doctors and medical practitioners disclose information to the patients. So as you can see, back in the early 60s, physicians would oftentimes avoid telling the patient of a diagnosis of cancer. Now, to the modern ear, that is unheard of, right? It's really hard to believe that somebody would do that. But we see a development in the 70s going against that perspective and saying that no, patients should be, have a right to know what's going on with their bodies, even if the doctor feels that information might upset the quality of life of that individual. Also, that they experience full disclosure are more likely to comply with treatment. So if you are open with disclosure, there's a trust that develops between the patient and the doctor. That's why maybe there was some distrust that grew between patients and doctors because the doctor wouldn't tell them. But now there's probably a little bit more, although there are some situations where there isn't. There's a lot of distrust based on financial institutions and pharmaceutical companies pushing particular drugs, but we won't go into that. However, if truth-telling is done so poorly, the argument is that sensitivity, care, and non-confusing terminology are important. What this means is that not only is it important that you tell the truth to your patient, you're open and honest with them, but you also have to explain. You have to explain to them what is wrong with them in ordinary, everyday terms, and not use a bunch of technical jargon that they're just simply not going to understand. Because when you do that, then do they really know what's wrong with them? They'll be like, look, doc, I don't speak this language. What is wrong with me? So it is important, or some say it is important, to use sensitivity care, non-confusing terminology. Another argument is that patients do not want to know the truth, particularly if the prognosis is grim. So there are people, that would rather not know at all. Ignorance is bliss. They don't want to know what's wrong with them, what's wrong with their bodies. So you have two sides, right? You have people that feel that they want to know everything that's going on with their bodies, and they feel that full disclosure and coherent disclosure, not just a bunch of technical jargon that's confusing, should be available and made available to the patients. Whereas on the other hand, patients don't want to know. They would rather live ignorantly if there's something that is untreatable, and they don't want to know about it. The data suggests that patients mostly do want to know the truth. And while I would ask the class right now that question, I don't, since there's no one in the class, I can't really ask that. But I would venture to say the majority of you listening would agree that you would want full disclosure on that. The main argument for full disclosure is that of autonomy. Going back to what we were talking about, autonomy. Patients deserve the right to decide how to deal with such information. Previously, in earlier eras, the doctor was seen almost like a god. Right? The doctor was seen as someone who made the decisions not only for the treatment of the patient, but how the patient is told and what the patient is told about their own bodies. But now we're coming to an era where that's not the case. Patients and the autonomy of patients is more important. This actually goes along with deontology, which is something we've talked about. Deontology is the obligation to treat a person as an end in and of themselves. So although you are interested in making sure that you're providing them with happiness, you're trying to make them as comfortable as possible, they also need to know the truth, and they also need to be treated as another person, as an end in and of themselves, and it's important to be open and honest with them. So patients deserve the right to decide. And this goes along with deontology and Kantian ethics. The key is communication and how the information is presented. Again, this goes back to the idea that if there is a condition the patient has, it's important that you're able to communicate this technical sort of condition that the person's suffering with in everyday layman terms, so that the person understands what's wrong with them, so that they can make decisions based on treatment, if they want treatment at all. So confidential truths. Confidentiality concerns patients imparting information to health professionals who promise implicitly or explicitly not to disclose information to others. So you're not going to have a couple of nurses sitting around going, talking to some people on the street. Did you see what I saw in the ER, last night? You can't talk about that. You can't say, I saw someone with a vacuum cleaner, stuff, whatever. You can't talk about these sorts of things. This is really important, not just for the sake of embarrassment or for the sake of treating a person as an end in and of themselves, but there are real practical concerns with respect to insurance and the medical care that they're receiving. Whatever I say, so the Hippocratic Oath says, whatever I see or hear professionally or privately, which ought not to be divulged, I will keep secret and tell no one. So this does actually fall under the ancient Hippocratic Oath. Consequentialist and non-consequentialist arguments for confidentiality. The consequentialist would be like, well, the consequences of revealing this information is going to cause embarrassment. It's going to cause your insurance premiums to go up and all this sort of thing. These are the consequences. The non-consequentialist is you should simply not divulge information about someone else. It's just wrong inherently, regardless of whether the consequences are good or are bad. Doesn't matter. You have an obligation to treat that person as an end in and of themselves. And this goes along, of course, with HIPAA, of course. So that's it for this lecture, and I will see you guys next week.